Hello, class. Just wanted to give you a little information on what it is to be a lab tech in the military. I'm going to try to cover quickly what we do and the different areas of the lab and a little bit about each one. So for a lab tech in the military, you have receptionists. It's where everything starts. You meet and greet the patients, confirm their identity, and then you send them on back to the draw room to get samples. So in the draw room, we're now phlebotomists. That's just sticking needles in arms, taking blood, and running tests. We need those results to get to the doctor as soon as we can so we can find out what's going on with the patient or just do a routine test just to make sure everyone's healthy. So now that we covered the basics of where we start, we're going to move to the back of the lab. This is where med lab tech really is if you're on the civilian side. So you have your main sections. You're going to have chemistry, hematology, micro, blood bank, urinalysis, shipping for samples you do offsite. So in chemistry, you're going to do a lot of tests. It's the vast majority of the testing. It's going to be things like electrolytes, your cholesterol checks, and other pretty basic things. In hematology, we're going to look for what's going on in your blood cells, so what it's composed of. It's going to be how many white cells you have and the different types. It's going to let people know if you have a viral infection, or if you have a bacterial infection, or if you're healthy, maybe you have sickle cell anemia. We'll look for things like that, and that'll be under the microscope. In microbiology, you're getting a little more complex. There's a lot of things that can happen in there, different types of samples. You're going to have swabs, which will be like a wound swab. They're just going to see if anything's growing there. You might have a staph infection, something like that. We also use stool. It gets a little smelly in there, so we have ventilated hoods. Those take a couple days to grow, just like many things in microbiology. That's going to help determine different kind of pathogens, see what's going on so they can get treated. We also have blood bank. It's probably our most important section. They're going to use it for blood transfusions, things like that. Very important to not make any mistakes in that section because they can be life or death. If you make a mistake, get the wrong blood type, your blood will clot within your body, and that's not good for anyone because you're probably going to die. So it's very, very important to stay to your checklist, follow your operating instructions perfectly, and make sure you're double checking everything you do. There's also going to be urinalysis as one of our other sections, and that's exactly what you think it is. It's working with people's urine. So for that, it's going to be just seeing what's going on in there. Is there blood? Is there bacteria? See if you have a UTI, see if you're pregnant, things like that. It's a little smelly of a section as well. And if the flags for anything on our analyzers, we're going to look at it under the microscope. And you shouldn't see anything normally, but if you do see stuff, you might want to record that, let the doctor know, and get a diagnosis. So now we have shipping, which is also an important section, because I work in a small clinic, so we can't do everything. So we have to rely on outside laboratories, whether they be military or civilian. We currently use LabCorp as our civilian reference lab. Those can take a lot longer for tests because they have to be shipped. So with that, results will be delayed. Our doctors know, but we still want to check on those results constantly in case it's important to the patient or the doctor. There's also a tiny section, which is going to be for parasitology. We don't see much of that or any of that in my laboratory. We only ship those out to Wright-Patterson Air Force Base. And really, you're not going to see that much in your career at all. That pretty much covers the entirety of the lab. Hopefully you gain some knowledge of what we do. And if you're interested, it might be the career for you. Thank you and have a great day.